Welcome. In this presentation, we will cover Heliox administration. Our objectives for this presentation is to go over indications for therapy, the type of gas we will be administering, how we can administer said therapy. We'll also go over initiation and monitoring, and last, how to set up our delivery devices. Helium is a natural gas. It's odorless, tasteless, and non-toxic. The effects of Heliox can occur within an hour of delivery, providing an emergency solution to reduce airway resistance and respiratory work until the underlying factors can be addressed. In addition, due to its low molecular weight and density, it passes through valves and airways with less turbulence. We can visualize this here. On the left, we have room air passing through the airways. As you can see, the air is turbulent and moving with difficulty. So this is our air hitting the walls and passing turbulently through the airways. On the right, we have Heliox passing through the airways. As you can see, the air is moving more laminar, allowing the gas to pass a lot easier through the airways. The major benefits of Heliox comes from its lower density and improvement in flow dynamics, and therefore it's primarily used for treatment of upper airway obstructions, whether caused by a foreign body or inflammation, croup, and post-extubation stridor. Heliox has also demonstrated usefulness in obstructive lung diseases as a vehicle for better deposition of bronchodilators. And you can see here a more comprehensive list of uses reported uses at other facilities. At Peace Health, we use the most common Heliox concentration of 80-20 blend. These tanks are actually filled with 79% helium and 21% oxygen. You can also find a 70-30 blend. Heliox should be delivered with a calibrated Heliox regulator, but if one is not available, you can use a traditional oxygen flow meter. You will have to multiply the flow by 1.8 to determine the actual flow because of the lower density gas. When using Heliox at Peace Health, you will find it in an H cylinder. To determine the delivery time available, you'll use the following equation. Pressure in PSI times the cylinder factor, which is 3.14 for H cylinder, multiplied by the flow in liter per minute. Fun fact, Heliox will make speech sound squeaky, but will revert back to normal soon after therapy is complete. Heliox can be administered via multiple different methods, including high-flow nasal cannula, non-rebreathing mask, small volume nebulizer, non-invasive ventilator, and finally a mechanical ventilator. But take note that at Peace Health Southwest, we do not deliver Heliox via high-flow nasal cannula, non-invasive ventilation, or mechanical ventilation. So our only mode of delivery is the non-rebreather mask or a small volume nebulizer. When initiating Heliox therapy, the patient should be started on a flow rate of at least 10 liters per minute when using a non-rebreather mask, and titrate to meet the patient's demand. You want to achieve a total flow of at least 10 liters a minute. This is either coming from the regulator or your oxygen combined flow of 10 liters. We also want to maintain an oxygen saturation of 90% or greater, or our physician's order. Heliox is proven less effective when given in concentrations of greater than 40% FiO2, which is a contraindication here at Peace Health. So keep note, increasing O2 will actually decrease the ratio of helium to oxygen delivered to the patient. Let's take a look at the Heliox flow chart and let's learn how to use this. So when we want to determine what flow will give us a certain FiO2, we can start at the top and work our way across. Here we have our Heliox regulator flow. On the other axis, our y-axis, is our oxygen flow coming from our oxygen flow meter. So if we're trying to deliver, for example, let's say 40% FiO2, we can deliver that at 12 liters Heliox and 4 liters oxygen to give us a total flow of 16. We can also increase our flow and still maintain 40% FiO2 by going 15 liters of Heliox and 5 liters of oxygen, which gives us a total flow of 20 liters per minute. Remember, we want to keep our FiO2 at 40% or less, otherwise it is a contraindication. In our flow chart, this green highlighted area is marked, so that way we know which flows will deliver that 40% or less FiO2. Monitoring Heliox therapy. So we want to assess and monitor for signs of improvement initially and during the first 30 minutes of therapy using our criteria below. We're going to be assessing our respiratory rate, SpO2, heart rate, anxiety level, work of breathing, and if available, our entitled CO2. We want to monitor our patients every 30 minutes for the first 2 hours, then every 4 hours and as needed for signs of improvement. We're going to complete Heliox therapy and notify our physician when there's no significant clinical improvement based on our above criteria is observed after 30 minutes of initial therapy. We also remove it if the patient remains stable or no deterioration of clinical conditions in 30 minutes post-Heliox therapy. So let's go over setting up our delivery devices. We'll go over the first one, which is a non-rebreather mask. We'll first start by removing our safety cover on our tank. This is a typical tank you will see in most hospitals. It is majority brown with a little bit of green on the top. Once we remove our safety cover, we'll attach our Heliox regulator. This regulator has a PSI cylinder gauge and a flow meter combination. Once our regulator is attached, then we attach our Y tubing. Our Y tubing looks just like it sounds. It starts off at one end and Y's off. At the Y end is where we're going to attach our delivery device, so in this case a non-rebreather. At the opposite two ends, one end will go to our oxygen source, so the oxygen wall flow meter, and our second end will go to the Heliox regulator. All this equipment can be found typically hanging from the equipment bag on the tank itself. Otherwise, please ask your lead or educator for help locating your equipment. As mentioned, we can deliver Heliox via a small volume nebulizer. When we do so, we want to set our Heliox regulator and oxygen source to 8 to 10 liters while maintaining that 40% FiO2 or less. The 8 to 10 liters is because that is what these small volume nebulizers require to aerosolize the medication. Now, the nebulizer itself can be attached directly to the Heliox 80/20 regulator if the patient does not require any increase in FiO2. So you would attach this end here directly to that brown and green Heliox regulator and set your flow to 8 to 10 liters a minute. This concludes the presentation on Heliox administration. Thank you for participating in this education. Please ask your clinical educator if you'd like additional resources regarding Heliox administration or hands-on learning on the delivery devices.